So first I'm going to check the patient's chart. I am going to gather any supplies I need. I have my pen light here. I'm going to gather any PPE that I need, wash my hands, and then I will go into the patient's room. Knock, knock, knock. Can I come in?
Yes.
Hello, I'm Libby. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth?
Tori Whitney, 5293.
Perfect. So today we're going to do a physical assessment from head to toe. Should take about 15 minutes or so. Any questions?
Not at all.
Fantastic. So normally I would do a breast exam and where I would drape the patient and inspect for any swelling, symmetry on both sides, and the shape is similar on both sides. I would then use the 3-finger method and do a vertical test from outside in on both breasts and feel for any nodules, anything like that. And then I would squeeze the nipple for any discharge or tenderness. And then I would educate the patient to do that once a month, 4 to 7 days after their menstrual cycle. Shower or lay down, either works. For a male patient, I would do a testicular exam where I would also drape the patient and then inspect for any swelling, lesions, anything like that. And then I would use my 2 fingers and my thumb and feel horizontally each testicle individually and in between each testicle for any nodules or lumps. I would let the patient know that if they're feeling it themselves, the left one does hang a little lower than the right. And then I would educate the patient to do this once a month after any warm shower. And now I'm going to do my exam on my patient. So first I'll start with the head. I'm going to feel for any lesions, bumps, anything like that. Make sure there's no dryness, vermin. Hair is distributed evenly around the head. Do you feel any pain when I touch anywhere?
No.
Okay, fantastic. Size and shape are both normal cephalic. I will then look at the eyes. Eyebrows and eyes are both symmetrical. There's no drooping of either eyelid. Both eyelids hit the iris. I'm going to go ahead and look at your pupil reaction. So go ahead and just look at my nose here. Perfect. There. Great. So both pupils are dilating and reactive. I'm going to go ahead and then move. Do you feel any pressure here?
Not at all.
Any pain? Any pain here?
Not at all.
Perfect. Okay, so then I'm going to move to your ears. I'm just going to pull on them. Let me know if you feel any pain or tenderness. Anything?
No.
Okay. Then I'm going to do a whisper test. So I want you to hold your ear or your hand over one ear and I'm going to whisper 3 words. And then you just tell me what I said, okay? Just repeat it back to me.
Garbage, tree stand, trash can.
Perfect. And now I'm going to have you do the opposite.
Trash bag, wallpaper, t-shirt.
Perfect. Okay. And then if I had the tool, I would look inside the ear. And on the left ear, I would look at the 7 o'clock angle and look for the tympanic membrane, make sure it's pearly and gray. And then on the right ear, I would look for in the 5 o'clock region, again, tympanic membrane, make sure it's pearly gray. Look for any extra earwax or anything like that, any obstructions. And before I forget, I'm going to do the cardinal gazes here. So I just want you to keep your eyes on this pin. Don't move your head at all, okay? Just follow the pin with your eyes. Perfect. Okay, and then I'm going to check the sclera and conjunctiva. Sclera is nice and white, conjunctiva is pink and moist. Now I'm going to take a look at your lips here. They are moist and pink as they should be. Go ahead and open your mouth here. Teeth are looking good, no sign of infection. Gums look good, nice and pink. Go ahead and stick your tongue out. Wonderful. Go ahead and open your mouth and say ah.
Ah.
Uvula and soft palate both rise as they should. And then I'm going to go ahead and move to the neck here. See back here. Check your trachea here. Feel symmetrical. Go ahead and swallow. Wonderful. Thyroid rises as it should and falls back in place. I'm going to check the 10 lymph nodes. Just let me know if you feel any pain or tenderness when I touch.
Not at all.
Okay, perfect. Let me check this side. Any pain, tenderness?
Not at all.
Perfect. So then I will check your skin here. I'm just checking for the temperature. It's nice and warm, dry, but not dry skin necessarily, but it's not no sweat or anything. Skin is a white or pink tan color, which is good for the race. And then I'm going to check the turgor here. Just going to have you bend your hand here. Perfect. And the skin falls back in place as it should. I'm going to check your nails now. So I'm just going to squeeze them, make sure it refills, and it does within under 2 seconds. Go ahead and put your fingers like that. I'm just going to make sure there's a space between them, which there is, so there's no sign of clubbing. Nails look clean, strong, the nail is clear. Underbed is nice and pink, as they should be. And then I'm going to do a muscle test, okay? So I'm going to have you just go ahead and stand on up here. I'm going to have you walk from this side to that side. All right, gait is symmetrical and smooth. That's good. Before you sit down, I'm going to have you move all your joints. Go ahead and move your shoulders, wrists, elbows. Go ahead and move your knees, ankles. Perfect. And before you sit down, I'm going to do a scoliosis test as well. So I'm just going to have you bend over. Nice. There you go. Make sure your hips are nice and even. And go ahead and stand back up. Perfect. Okay, I'll have you go ahead and sit back down there. We're going to do a little strength test with your muscles. So I'm just going to have you hold your arms out. Go ahead and pull up against me. Now push down. Perfect. Go ahead and bring your arms up like this. Go ahead and push against me. And push against me this way. Perfect. I'm going to do the same with your legs. So go ahead and push against me. And push against me this way. And now I'm going to check your joints. So go ahead and bend your knees again. There's no crepitus or popping, anything like that. No nodules. I'm going to check this elbow for the same thing. There you go. And this elbow, again, no nodules, no crepitus, anything like that. And then I'm going to check your nose real quick. So it is symmetrical. Any pain or pressure when I touch? No. Okay, there's no nodules or anything like that. No obstruction in the nares. And no extra discharge, anything like that. So, I believe that's all I have for you today. Do you have any questions?
No.
All right, one more thing before I forget. I'm going to check if you have any popping when you open your mouth and shut it. Perfect. So, no TMJ that I'm noticing. Now, do you have any questions?
No.
Wonderful. Well, thank you for letting me do my assessment on you today. I will step out, shut the door, take off any PPE that I have, wash my hands, and document all of my information.